Aloha! I'm Shelley Redford Young, welcoming you to the beautiful island of Kauai. Today we're going to do a full body demonstration on the lymphatic hot rocks massage, the same one we offer at the pH Miracle Retreats in Valley Center, California at our avocado ranch. Whether you're a licensed massage therapist using this DVD for training purposes, or maybe you're just a lay person that would like to use the lymphatic hot rocks massage to help your family or a loved one. Either way, you'll enjoy the instructional DVD that you're about to see. Lymphatic hot rocks massage combines the therapeutic strokes of moving lymph through the body with the soothing heat of hot stones. I hope that you'll enjoy the instruction and the demonstration today on the lymphatic hot rocks massage, and as always, salute to your health. Question: what if there was something that had the potential to improve circulation, increase your body's ability to use nutrients and improve digestion, reduce your level of stress and relax muscles, help balance your hormones, aid in cleansing your body and speed up the elimination of waste, aid in strengthening your immune system, and do it all in 1 hour? Would you be interested? This is lymphatic massage. Like the live cell and dry blood tests, lymphatic massage is of German origin. Dr. Emil Bader, a European physical therapist, developed manual lymph drainage in the 1930s. This is fully accepted by medical insurance plans in Europe, and doctors write prescriptions for this treatment on a routine basis there. It is a complement therapy for an alkalizing lifestyle. What is the lymphatic system? It's a secondary circulatory system which runs parallel to the blood system. A meandering network of nodes, lymphatic capillaries, vessels, and fluid called lymph, which is 95% plasma. Sometimes it's called the body's sewage treatment center or vacuum system. Other organs that contain lymphatic tissue are spleen, thymus, appendix, tonsils, and bone marrow. Lymphatic vessels have one-way valves that go toward lymph nodes. The lymphatic system has no pump like the heart, so it relies upon motion and pressure produced by muscles, breathing, and new lymph pushing and replacing old lymph. Let's talk about the lymph nodes. They can vary in size and shape from a hemp seed to an almond. The body can have between 400 and 1,000 lymph nodes. Half are in the abdomen region and around the major organs of the body. The main nodes are cervical in the neck, axillary in the armpit, cubital in the elbow, inguinal in the groin, and popliteal at the back of the knee. Lymph being returned to the bloodstream passes through the nodes. Nodes are like checkpoint stations that quarantine and destroy toxic products. They contain white blood cells, which are garbage collectors called lymphocytes. Let's talk about the pathway of nutrition. Everything you eat or drink goes into the digestive system and ends up in the small intestines. The intestinal villi have lymphatic lacteals. They both absorb all your nutrition and take it out into the bloodstream and lymph to feed and bring nutrients to your cells. Like an ocean tide, the liquids bathe all of your cells and tissues. Blood and lymphatic capillaries receive back the fluids to further filter and detox them and send them to the lungs, liver, kidneys for excretion. The intestinal villi is your literal root system. Look at your intestinal tract. It takes up 9 yards. And look at the cross-section of the intestinal villi in the intestinal tract. The surface area of the intestinal villi along with the microvilli that come off the villi, can cover the surface of an area the same size as a tennis court. Let's talk about lymphatic drainage. Both legs, the left torso, and the left arm drain through the thoracic duct. The right arm, the right torso, and the right part of the head drain through the right lymphatic duct. You'll notice in the lymphatic hot rocks massage a pumping action in the soft tissue just over the clavicles, where we are stimulating the thoracic and the right lymphatic duct. This is a picture of how the lymphatic system intertwines with the vascular system and the one-way valves found on the upper left of the picture. Also, in the center of the body, there's a small, long organ called the cisterna chyli, which rations out toxins to the liver, kidney, lungs, as the body is able to rid itself of acidic waste. Let's talk about what happens when we have lymphatic blockage. When the lymph slows down, the cell is suspended in a toxic, acidic moat. Fresh oxygen and glucose cannot get to the cell. The glucose then ferments in the interstitial spaces and the cells mutate, causing pleomorphism. Because of the lack of oxygen, the mutated cells feed on the fermented glucose. Degeneration and disease are created. So what happens in the way of symptoms when the sewer backs up? First of all, pain can be experienced from unoxygenated cells and toxicity. Second, blocked circulation. Third, fluid retention or edema and swelling. Fourth, loss of energy. Fifth, degenerative diseases such as cancer, MS, bursitis, carpal tunnel syndrome, stress, cramps, fatigue, chronic fatigue syndrome, fibromyalgia, and lymphomas can develop. And finally, enlarged lymph nodes. Lymphatic massage is performed by stroking in the same direction as the lymph drains, towards the nodes and the heart. It works in the connective tissues that house the lymphatic vessels. The pumping action felt in the massage is to accelerate and stimulate the vacuum effect of the lymphatic system. There are ways you can love and help your lymphatic system. First of all, hydration. Make sure you're drinking 4 liters of alkalizing greens a day. Keep moving with good exercise, walking, jumping on a trampoline, swimming, working on a vibrafirm, a whole body vibrational machine. Deep breathe to release the toxins and increase oxygen flow. Get proper rest and relaxation. Use an alkalizing and energizing 80-20 diet. Use a far infrared dry heat sauna. And get a lymphatic massage at least once a week. Make sure your client is comfortably situated on your massage table and discreetly draped. Use liberal amounts of oil before placing your hands on the client. With a very soothing stroke, stroke upwards along the bridge of the nose, and then with a palm stroke out to the sides of the head. Brush fingers over to one side of the head and stroke up and forward, traversing across the forehead to the other side. Take turns and have the hand follow across and stroke up and forward, traversing to the other side of the head. Now take the palms out to the outside temple region on the head and do 3 short egg-shaped pumps and 3 pumps under the cheekbones. Then work down to the jawline and pump, feather up, pump, feather up, pump, feather up. You want to do your pumps towards the heart and feather touch upwards to start again. Down to the temples, pump, feather up, feather up, feather up. Pump, pump, pump. Then cup under the cheekbones and pump, 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 pump. Down to the jaw. Pump, feather up, pump, feather up, pump, feather up. Finish up with a nice stroke up the jaw and rest on the ears and give the ears just a good finger and thumb massage to loosen them up and hit all of the acupressure points which are found on the ear. This will further relax the client as you proceed with the massage. Finish up by rubbing the back side underneath the ears. Reapply massage oil as needed and make sure your hands stay warm. Next, gently turn the client's head to the side and with a broad stroke, stroke downward with pressure and feather up to the start. Down and feather up, down and feather up. Next, use the thumb while cradling the back of the neck and do the same stroke broadly over the side of the neck. Support the head and gently turn to the other side and repeat. Always remember that we are moving lymph towards the heart, and this will dictate the direction of the stroke. Next, to lengthen the spine and the neck and further relax the client, gently pull underneath the jaw and the head and stretch the neck. The rotary turn or the rotary stroke behind the neck will move lymph down the neck towards the heart. The client should totally relax their head and let you do this stroke with pressure down and feathering up. Down, feather up, and finish with a nice push on the trapezius muscle, broad strokes with the palms and back up the neck, over the clavicle, and our first thumb pump into the soft tissue over the clavicle. Again, make sure your hands are well oiled so you can slide and glide across the skin. Each time you go across the shoulders, give the trapezius muscle a good soothing stroke. Then pull the stroke up over and do another set of pumps in the soft area just above the clavicle, somewhat like punching the keys on a piano. Proceed the stroke to the axilla area of the body just above the armpit. Come down up the deltoid muscle through the trapezius and pump, 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 pump. Out to the axilla area with the same set of pumps. Next, use a fist stroke to work out kinks and tension area through the trapezius muscles. This is a place most commonly where people hold a lot of tension, and it's a good idea to do this stroke liberally at the start of the massage. One more set of pumps. Again, we're pumping over the thoracic duct where the lymph drains each side of the body. So we want to make sure we do these pumps to create the vacuum in the lymphatic system that will move fluid or lymph along. Next, ask your client to please hold their arm vertical so that we can use gravity to help move lymph down the arm and towards the shoulder. Liberally oil the arm and your hands, and start by supporting the hand in your hands and strokes going towards the heart or downward toward the wrist on the hand. Make sure you hit each finger. Support the back of the fingers with your fingers, but use your thumbs to stroke down the finger and into the palm. This should be very, very pleasing to the client. Once you're done with the fingers, do zigzag strokes down in a downward motion across the palm, working from the top of the palm down to the wrist. Crisscross, crisscross, and then you can also add in a few circles, upward circles with the thumbs too, just to get the palm to relax. You can see how my thumbs crisscross over each other. The hand has a lot of bones in it, a lot of nerves, and almost everyone enjoys a good hand massage. Next, we'll proceed from the wrist to the elbow with a lymphatic stroke done in threes. The pressure will always be down and feather up, down and feather up, down and feather up. So the pressure is done on the down stroke with a very light touch when we feather back up to the start of the stroke. So whenever I say feather, I mean a very, very light touch, and whenever I say pressure, I mean give more pressure. Down, feather up, down, feather up, down, feather up. When we come to the elbow, gently bend the client's elbow while supporting the wrist and give 3 short, quick pumps over the elbow. Try to think of your strokes as going in sets of 3, and on the third stroke going all the way back up to the top, to the wrist, and give each section of the body about 3 strokes of 3. Next, work from the elbow down to the shoulder the same way, working both the back and front of the arm with long gliding strokes, pressuring down, feathering up, pressure down, feather up, pressure down, feather up. Once we've worked from the elbow to the shoulder, on your final strokes, go down around the deltoid muscle coming up through the trapezius, and on the clavicle side that you're working, give another 3 pumps into the soft tissue just over the clavicle. This stroke should also be very therapeutic and soothing to the client. To finish up, give a broad palm stroke all the way down the arm, again across the trapezius into the clavicle, and one last set of pumps. Gently bend the elbow and place the client's palm across their stomach. Make sure your stones are a good temperature, that you're able to touch them, and make sure your hands and the stones are well oiled. Use the smoothness of the stones to come down in pressured strokes down and lift the stones as you feather up. You can also turn the stones over in your hands to give more warmth to the client. Always test the stones and ask your client if the temperature is comfortable for them, as each person has a different tolerance for hot stones. Some may like them very, very, very warm, and some may like them a little bit lukewarm. Some clients like them very, very hot. So always check with your client for the comfort level.